Thank you everyone for joining us today. We're very excited about this webinar on the community level social welfare workforce. As Mana mentioned in the chat, please go ahead and introduce yourselves in the chat. And there's also a Q&A questions and answers function. So if you have specific questions, please put them into the Q&A function. We will take a quick look at the chat as well, but we're more likely to capture all the questions if you put them into the Q&A. We have a lot to cover today, so I think we'll just get started and people will join as we go. So yes, on that note, we'll move to the next slide. I will quickly share the objectives of the webinar today. As you can see, there are 5 objectives. The first is to share key insights from a 9-country analysis that was carried out on community level social welfare workforce. And then that will be followed by sharing the key steps in a guidance that was developed on how to support and strengthen the community level social welfare workforce based on the findings coming out of the country analysis. We will highlight some practical examples, including one country case study, facilitate shared learning and discussion across agencies. We're happy to see that we have different agencies present here today. And we'll explore next steps for strengthening the community levels social welfare workforce. So moving on to the next slide, we will look at the agenda. We'll start with welcome, which I have now said to all of you, which will be followed by opening remarks. And then we will share again insights from the 9-country analysis, followed by a breakdown of the key components of the guidance that was developed. We will look at a specific case study for Uganda, and then we will talk about the power of collaboration. We'll have a Q&A session and closing remarks. So this is what we're going to get through, and we're very excited to be here with you today. So moving on to the next slide, let me quickly introduce ourselves. My name is Birgitte Lund Henriksen. I'm a senior child protection advisor with Save the Children Norway and have worked many years abroad, particularly with UNICEF. So I will be moderating the session, and we have the 3 panelists who you see here. Hugh Salmon is the director of the Global Social Service Workforce Alliance, started his career as a social worker, and has many years of international global experience. Mana Miyawaki is a child protection technical advisor with Save the Children Japan and has over 13 years of experience in child protection and other areas. And then we have Yuko Nishiguchi, who is a child protection advisor with a special focus on Asia for Save the Children International, also with over 15 years of experience. I'll be introducing more people as we go, but this is the core team. I also want to take a moment to thank Family for Every Child and Global Social Service Workforce Alliance staff who've really supported in putting the webinar together. We really appreciate that. And Hannah Rizvanoli from Save the Children International, who's also been really instrumental in pulling all of this together. So thank you so much for that. On that note, we will move on to the next slide. And we will have opening remarks by Becky Smith, as we know her as, who's the global head of the child protection program for Save the Children International. You can see more details of Becky here. And on that note, let me hand over to you, Becky, for the opening remarks.
Wonderful. Thank you, Brigitte. So today we're focused on the community level social service workforce, those individuals who are absolutely essential at making a child protection system work, but they're very often overlooked. I'm talking about the volunteers and the paraprofessionals who are on the front line of protecting children every single day. These individuals play a vital role in preventing and responding to child protection in their communities. They're the ones that notice when something's not right with children. They're the ones that mobilize community resources for supporting children and families and bringing communities together when a crisis hits. And yet, despite their significance, their roles and responsibilities are frequently under-recognized, under-supported, and insufficiently integrated into the broader child protection system. Their work is invisible, but their impact is profound. And that's why today's webinar, hosted in collaboration with our wonderful colleagues from the Global Social Service Workforce Alliance, is so important. Our aim is to strengthen the community level workforce through a reflective, collaborative, and systems-based approach. This is not only a technical conversation, it's a localization conversation. In the world we face today, external actors must acknowledge that real protection starts naturally at the community level. During moments of shock or conflict or disaster, it's not the international agencies that arrive first, it's the community volunteers, the parents, the local leaders, and the neighbors that step in with whatever they have. And our role is not to replace them, but to recognize them, value them, and support them with humility. During this session, we'll share key learnings from 9 different countries, offering a clear picture of the challenges and strengths that shape the community-level social welfare workforce in different contexts. We'll also introduce new practical guidance designed for practitioners, governments, and partners that can help strengthen the community-level social service workforce in a collaborative, systematic, sustainable, and locally grounded way. So today, as we listen, reflect, and learn together, I invite all of us to elevate our appreciation for the community workforce and together explore ways to strengthen them as essential partners in child protection. Thanks, Brigitte.
Thank you so much, Becky, for those important points. Let me hand over to Yuko now. She's going to take us through the definition that was used during the development of this work and the guidance for the community level social welfare workforce. Yuko, over to you.
Yeah, thanks, Brigitte. So, community level social welfare workforce perform diverse roles in different settings, as Becky mentioned, but share a common goal of keeping children safe and protected with and within a community. Most of them are volunteers or paraprofessionals, but once again, their roles vary. They facilitate children and families access to support, prevent child protection issues, strengthen families, and contribute to other community-level child protection efforts. In some contexts, they also perform a very important role in emergency preparedness planning, and they are also the one at the front line of response during emergencies. Based on the definition, the community workforce can be child protection volunteers, focal point person within child protection committees or groups, or facilitators of community-level MHPSS group activities for children. But they're not social service providers of other sectors such as health and education. They're not professional social workers or caseworkers either, although it remains critically important for them to ensure coordination with them. Thank you, Brigitte. Over to you.
Thank you so much, Yuko. I will now hand over to Mana, who's going to take us through some of the key learnings coming out of the 9-country analysis. Mana, over to you.
Thank you very much, Brigitte. Good morning, good afternoon, everyone. So I'll be presenting key findings from the analysis, a study conducted to understand the current realities of the community-level social welfare workforce and identify ways to strengthen this essential workforce. So this analysis covers 9 countries from various contexts and regions listed in the slide and draws on a review of 160 documents and 15 key informant interviews involving government officials, partners, experts, and Save the Children staff. Across all contexts, the study highlights that the community-level social welfare workforce is essential, yet often under-resourced element of national child protection systems, and strengthening this workforce is central in improving child protection outcomes. The report stresses the need for systemizing contextually appropriate strategies to support this workforce through a child protection system strengthening lens. And these strategies include more clearly defining roles, and responsibilities, and competencies, strengthening competency-based capacity development, and improving supervision and accreditation. In the next slide, we will go into more detail on some of these key points. So one of the strongest findings, which I really want to emphasize, is that despite wide variation in roles shaped by local challenges, cultural norms, and limited resources, the community-level social welfare workforce across 9 countries shares a common purpose, working closely with community members, including children themselves, to keep children safe and protected. These workers are deeply grounded in their communities, responding directly to community realities. As a result, they are well positioned to identify protection risks early, mobilize local protection efforts, and connect children and families to services. While these strengths are very clear, the report also identifies several systemic gaps that hinder the effectiveness and sustainability of the workforce. First, recognition gaps. So the roles of the community-level social welfare workforce often lacks legal recognition and definition. Without this, the workforce remains under-supported and inconsistently integrated into the national child protection system. The second is unclear eligibility criteria. The analysis highlights inconsistent or informal eligibility criteria and selection standards. In some cases, roles are designed in a more cookie-cutter manner and imposed by agencies, rather than reflecting local context, existing community structures, and mechanisms. This can lead to a mismatch between what communities expect the workers to do and what workers are actually prepared, mandated, or supported to do. One key learning from the report is the importance of creating space for communities and local actors, including national and subnational government partners, to be the decision makers in defining what community-level social welfare workforce do and how they are selected and supported. Third, vague job descriptions and unclear roles. Missing or vague role descriptions hinder coordination with other actors and services. This also increases the risk of overburdening community-level social welfare workforce with multiple responsibilities without clear boundaries, safeguards, and adequate support. Fourth, inconsistent competency frameworks. The report finds wide variation in competency models across contexts. This reduces clarity around performance expectations and training needs, making it difficult to define essential skill sets or harmonize capacity development efforts. Fifth is the inconsistent or lack of training. Training is often not organized systematically to align with role-specific competencies. Instead, the sessions tend to be delivered in an ad hoc basis in a fragmented manner, than as cohesive, structured learning pathway. This affects quality and limits the effectiveness of workers who are routinely dealing with complex and sensitive child protection issues. Finally, limited technical supervision and accreditation. While administrative supervision may exist, the report points to significant gaps in technical supervision, mentoring, coaching, and accreditation. This limits ongoing workforce development, professional recognition, and accountability. So with this overview of key findings, I'll now hand over to Hugh for his insights from the findings.
Thank you so much, Mana. And again, welcome to everybody. It's wonderful to have this opportunity as Director of the Global Social Service Workforce Alliance to collaborate with Save the Children in this very important webinar. We're also hugely grateful to Family for Every Child. Those of you who are not aware, my organization is now a project hosted by Family for Every Child, and that also particularly enables us to collaborate with everybody through Changemakers. And hopefully those of you who are not members of Changemakers will soon join, and particularly can join the community in Changemakers, which is focused on social service workforce. I also want to say how important this issue is for us since our very founding in 2013. The reason that the Global Social Service Workforce Alliance was brought into being was because of this issue or this gap. The fact that there are qualified social workers in virtually every country now, but the social workers that graduate from universities typically don't end up in the communities that most need them. Whereas the communities that need social services and social welfare often have their own people as volunteers or paraprofessionals doing a very important role, but under-recognized and unsupported. So it's really important to improve the level of professionalism, but also clarify what roles they can do and what they cannot do, and how to link the community level workforce more clearly with the professional and more formal level workforce at district and provincial levels. So that's really our whole mission, and it's great to see this report. I'd also want to acknowledge just that Save the Children has been doing wonderful work in this area for some time. Jane Calder, who you'll hear from at the very end, is now the chair of our steering committee, but in her role with Save the Children was an extremely strong advocate when she was on our steering committee before, and generally in various audiences, just making sure that we always remember the community level workforce because they have such a key role to play, and particularly this competency-based approach, which as probably anybody who's heard me before will be bored of me saying, but it's so crucial that by competencies, we don't just mean formal trainings that go into the head and then get forgotten. We're talking about things that go into the heart in terms of values and ethos and principles. And we also have things in the hands, the practice skills. So it's the combination of head and heart and hands. That is competency, holistic competency. And that is what the community level workforce has, but has to be strengthened and reinforced through experiential learning and other opportunities, as well as supervision. I'm so glad to see supervision mentioned at the end, particularly the coaching and mentoring and supportive aspects of supervision. All of that is really crucial. I don't want to take any time away from my colleagues, so I think we'll hear more from the Uganda case study and others. But back to you. Thank you so much.
Thank you so much, Hugh and Mana, for these reflections and insights. Let's move now to the guidance itself. And if we can move to the next slide. Yes, and then I will hand over to Yuko, who will take us through key components of the guidance. Over to you, Yuko.
Yeah, thanks so much. And thank you, Hugh and Mana. So, drawing on a key lesson shared by Mana and Hugh, we discussed the need to systematize and enhance the way we support the community workforce across our movement. We then decided to offer very practical guidance that colleagues can reflect with other child protection partners and develop strategies to strengthen the workforce. These practical steps can be used both by those who are already working on this and by those who are newly considering it in their own program design. The guidance was launched on March 17, the World Social Work Day, and Mana, I believe, has shared the link to the guidance. It would be great if you could download it and refer to it when joining the presentation as well. Could you go to the next slide, Hannah? So now I'm gonna introduce the steps very quickly first. These practical steps are very straightforward and consist of 5 key stages. Prepare for the assessment, understand a current context, which is assessment, collect primary data if necessary and appropriate, reflect on the quality of work to strengthen the workforce, identify actions for improvement. And we really want to highlight that these steps are designed to align with the key parts of child protection systems as agreed in a framework for action to strengthen child protection systems. As you can see the image on the slide, for example, effective engagement with communities and children is central to the entire process, as is ensuring a continuum of care by strengthening linkages between communities and subnational and national level service providers. Throughout the process, it's so essential for us as child protection practitioners to support the leadership of the government actors, as well as other local relevant actors, including communities themselves. Our role is to ensure that decisions are owned by them and reflect local context. Simply working with local actors doesn't automatically mean we're supporting localization. Localization becomes meaningful only when the lived realities of local actors genuinely inform decision making. So that's what we've emphasized in a guidance as well. Could you go to the next slide? So now we'll take a look at each step one by one, and I'll start with the preparation phase. In this preparation step, we focus on ensuring coordination and collaboration with relevant actors, including government partners and other duty bearers. In humanitarian context, it's also essential to engage with the protection cluster and other relevant coordination structures. Together, we gather and review existing documentation such as job descriptions, training materials, and study reports that are relevant to strengthening the community-level workforce. As practitioners, we're often under pressure to develop new initiatives, but it's critically important to build on what already exists. These documents and materials form the foundation for step 2. Sorry, muted. These documents and materials form the foundation for step 2, where we look more closely at the current state. Could you go to the next slide, please? Thank you. Using the information gathered, we then address a set of critical questions on this slide to assess the current state of community workforce strengthening. These questions focus on key areas such as roles and responsibilities, selection criteria, management structures, resource allocation for the workforce, and as you mentioned, competencies, and capacity development, including training and supervision. It's also important to better understand the risks faced by the workforce, as well as existing risk mitigation measures, particularly in humanitarian settings. Now, we would like to do a short simulation focusing on one key question, which is about the workforce roles and responsibilities. Could you go to the next slide? And Deirdre, could you open a poll if possible? So we would like to do a poll, and the question is very straightforward. In a context where you work, what roles are currently performed by the community workforce? I wonder if colleagues can see the poll. So there are multiple options, and you will have 2 minutes to see and select, and you can select all that apply to your context. See the poll. I hope everyone can also see it. Okay, 30 seconds to go. And we'll close the poll. Great. So we're now seeing the answers, which is amazing. So we can see that a lot of the community workforce work on prevention, including family strengthening, disseminating messages, and we can also see that community level workforce has been engaged in safely recognizing the at-risk children, and they're referring children in need to appropriate services like case management. And we can see that they're also performing an important role in humanitarian assistance. Great. So now we will close everyone for joining. And then due to the time constraints, I won't go into the details on step 3, which focuses on primary data collection. We developed a set of questionnaires for key stakeholders, including government partners and the community workforce themselves. But if you're interested, please refer to the guidance for more information on that. And with that note, we'll return to step 4. And then in this step, we bring together insights from the desk review conducted in step 2 and any primary data collected. After we consolidate findings from the assessment, we look specifically for patterns, connections, and identify key insights related to factors such as the legal framework, workforce planning, roles and responsibilities as outlined on a slide. And using the format provided in a guidance, we can then assess the strength and weaknesses of existing practices against these different factors. And comparing your effective practices with less effective ones will help you identify gaps in strengthening your workforce in your context. Could you go to the next slide, Hannah? Thank you. And based on the identified gaps, the next step is for you to prioritize actions that can strengthen the workforce in a more systematic way. And you can see some of the examples of the actions on the slide. So for example, if community cadre and their roles are not clearly defined, it's critical to establish them. Their roles should reflect the local context and build on what the community workforce is already doing, rather than introducing entirely new or unfamiliar functions or processes. It's important not to impose an agency's agenda. So for example, assigning a community workforce to support specific elements of case management in some contexts is something that we often do. But in some contexts, it could expose the workforce to pressure or even harassment from community members. In such situations, it may be more appropriate to help them focus more on preventative functions, such as providing basic needs, mobilizing community resources, and supporting positive parenting as such. So roles should also take into account existing power dynamics and social norms within a community as well, and consider how the workforce can address these in respectful and community-owned, community-paced ways. This really goes beyond organizing one-off awareness-raising sessions and includes drawing on existing community measures and structures such as kinship or neighbor networks, meetings, gatherings, or intergenerational dialogue. In addition, selection criteria should also be contextually appropriate, where relevant community-owned selection processes can help build trust between a workforce and wider community. And finally, competencies should be clearly defined and aligned with the roles the workforce are expected to perform. The guidance provides examples of roles, responsibilities, and associated competencies that participants can refer to when working through this step. Mana's sharing that list, I guess. So thank you, Mana, for doing that. Could you go to the next slide? And once role-specific competencies are identified and defined, it's important to systematize the capacity development journey, capacity development pathway for the workforce. And this includes ensuring that ongoing supervision is in place, so the workforce has regular opportunities to reflect, learn, and receive technical support from more experienced practitioners. Supervision is particularly important for continuous learning and quality assurance during humanitarian crisis as well, rather than implementing training as a one-off activity. The guidance includes sample training materials as well as some practical tips for technical supervision. Colleagues can then use that to strategically select and organize these resources so the workforce can build their skills progressively rather than, and help them learn step by step in a structured manner. Other important elements relates to coordination. And once again, all of the aforementioned actions should be taken in a coordinated manner. It's far more effective to strengthen a single actions and a single system collaboratively and scale it together rather than having each agency create separate parallel systems or mechanisms that may not be used or sustained over time. Strengthening coordination at the local level is also important to ensure safe, appropriate, and well-functioning referral pathways too. And we also want to highlight the importance of sustainability planning. In the end, where possible, including the development of costed budget plans. While it can be challenging for governments to allocate funding, especially in a current context, joint efforts to mobilize resources across agencies may still be possible and can support longer-term sustainability during a challenging time. Well, thank you for listening in, and we prepared one more short poll, and based on what we've been learning together, what actions are you interested in taking? And of course, you want to do the proper assessment, but based on your initial thoughts, reflections, what actions do you think would be most appropriate or relevant to your context where you work? Again, you have maybe 1.5 minutes, and please select all that apply. For waiting, we also encourage you to ask any questions in a Q&A box. We don't have too much time, but we're happy to address any questions you may have. So. Hey, I hope everyone voted. So could you Show the results, Deirdre. Great. So good to see that you highlight the importance of defining the community workforce roles. And it's good to see that a lot of you are focusing on clearly defining the competencies that are linked to the roles. So thank you so much. I wish we had more time to discuss, but we're gonna hear a very interesting case study from Kevin. So thank you once again, everyone, and I'll hand back over to Brigitte and Kevin. And if you have any questions on the guidance, please feel free to ask us as well. We're going to drop our contact details at the end of the session as well. Thank you.
Thank you so much, Yuko, for introducing everyone to the key components of the guidance. We really encourage all of you to take a closer look at the guidance. Lots of very interesting and useful information there. And we're also seeing the importance of, on the one hand, making sure that we are working in a sensitive and appropriate way with the community context, while also ensuring that there is government leadership, that there is consistency, and that there is a standard approach to how we work with community level social welfare workforce and the role that they play. Also to over time, hopefully this can be absorbed into both government systems and government budgets to be able to really support them, like we've seen with the health sector, for example. It is my pleasure to invite, first of all, introduce Kevin Mubuke, who is a senior technical expert heading up the Child Protection and CRG, which is Child Rights Governance program for Save the Children Uganda. And sorry, she will share an example of what is happening in Uganda on this. So Kevin, over to you.
Thank you, Brigitte. Next slide, please. Thank you. Sharing the experience of Uganda, the process to systematize the community social workforce started with the launch of the National Child Policy of 2020, which clearly stipulated how we were going to continue working with the community-led social workforce. Previously, the social workforce was led by projects. When there is a grant, then a project would support a certain group of people to support children at the community level. One project would be working with a group called, for example, paralegals, fit persons, VHTs. And so with the launch of the National Child Policy of 2020, the system was systematized. And since then, we started discussions on what competencies would we need, what would be the selection criteria, guidelines to support the rollout, the implementation, and the support of the community social workforce. And therefore, working with the Uganda Ministry of Gender and Labour and Social Development, training procedures were agreed upon for this level, training curriculum was developed, selection guidelines were provided, which indicated how they would be selected, how coordination would happen, how different partners would collaborate on working with the social workforce. All this was stipulated very well after the National Child Policy of 2020. Initially, the projects that were supporting the community social workforce would, for example, be from UNICEF, from USAID, Save the Children, and other INGOs. And of course, we all realized that there was a problem. There was no systematic flow of support. Support was being given randomly, plus the country has over 100 districts, and this would not be spread out across the country. So with the national child policy, we have seen steps, having had the selection criteria, guidelines to support training, and therefore since then we've seen some achievements happening within our community social workforce, which is now officially referred to as the parasocial workers. So it doesn't matter which part of the country you will go to, you will hear a parasocial worker, and they might be trained formally or not trained or just selected, but all the child protection actors are moving into the direction of a parasocial worker and ensuring that they get the training that they require. To date, we have registered some achievements with parasocial workers. We have over 4,000 that have been appointed in different communities and are already supporting child protection. Please note that of the 4,000, some have got proper training that was designed. Like you will see in the report, there is a training that has been designed for over 20 days where these people are accredited after. But even without that kind of training, there are small competency-based trainings that are being provided to roll out the process. And as we get resources, we continue to train parasocial workers. Most of the training in country has been done by USAID, by UNICEF, by Save the Children, World Vision, and other actors to try and reach the goal of protecting children. And for now, we have job aids for parasocial workers because we realize that these people, yes, we have trained them, but because we don't have a very high level of education attached to it, they needed job aids. So in 2025, at the Day of the African Child, job aids for parasocial workers were launched. Right now, these job aids are not yet translated to different languages. In Uganda, we have over 70 dialects. They are still in English, but over time, this is the direction that we are taking. So we have parasocial workers that are trained. We have parasocial workers that are not yet trained, but selected and engaged in small activities and being supported on job. And then we have those that are being replaced. So generally the process is a mix. In one district or sub-county or village, you will find a parasocial worker that has been fully trained, and in another place you'll find a parasocial worker that received some partial training and mentorship, and of course there are those that are not yet trained. But the beauty is that within the guidelines we have coordination platforms. Among them we have, for example, sub-county coordinators, we have parish coordinators, and this is a way of supporting one another. We also have seen that as they do their work, one of the things we see is motivation for these parasocial workers, because right now, from the conversations we've had, these people are volunteers, and we are now thinking about how do we think about a stipend or an incentive to make them more active, learning from the health department. And this is something we are still grappling with, because within the community, these people are based at village level and have to support children within large geographic areas. So one of the discussions that is still happening, and probably it will take some period to materialize, is around their motivation, but this is work in progress. We have also had some challenges along the way. Like I said, so far 4,000 have been selected, and this is data as of 2025, but we have many more communities that require parasocial workers. The cost of training is very high, and this means that for us to be able to have every parasocial worker trained, it will take some time, it will take a lot of resources, and of course, like I mentioned, the motivation is not yet stimulated, so we still have challenges in that direction. But to say that along the way, we have picked some lessons as we work with this caliber of people. We have picked some lessons, especially how to narrow the gap between the parasocial worker in the village level who reports to the district level, which could be even 100 kilometers away, to a district focal person for children. We have seen that we need to strengthen collaboration so that these people can effectively report. So we strengthen coordination. We strengthen the parasocial worker at sub-county level so that there is a middle point. But we are also thinking about how else, working with government, how else do we support this middle ground such that when a parasocial worker identifies a case at the village level, it can easily reach at the district level. There are conversations happening between government, UNICEF, and INGOs to see how we narrow this gap and have children supported better. Parasocial workers in Uganda are present not only in the context that is development, but they are also present in both refugee hosting districts and those that are not hosting refugees. So they are supporting both hosts and refugee children, and the policies and guidelines cut across the communities as one. So the expectation is that what's happening in the humanitarian context cuts across the development context without variations. Thank you, and over to you, Bagite.
Thank you so much, Kevin. This is really insightful and useful. We understand that there are a lot of challenges rolling this out at community level and costs involved. But the impact over time, the efficiency over time that comes with a more government-led and standardized approach is really important to go beyond projects and specific issues and look at something where they can be supported consistently across the board over time. In the interest of time, let's move on. You've talked about, Kevin, the importance of collaboration. We've invited Aminul Islam from UNICEF. He is a child protection specialist, heading up he's providing global technical leadership to child protection system strengthening, to say a few words about the importance of collaboration. Aminul, over to you. Thank you.
Yeah, thank you, Brigitte. It's a pleasure for me to join today and represent UNICEF in this important forum. And definitely it's a very exciting piece of work, and the guidance particularly is going to be a very important addition to what we already have. As you know, in 2019, with Global Social Service Workforce Alliance, here we have done a framework and guidance for work on strengthening social service workforce. So this piece of work is going to add to that. Before going into the collaboration, we from UNICEF, we firmly believe that this frontline social service workforce is very, very important. And this is actually the backbone of the child protection systems to prevent and respond to violence against children in all contexts, including development and humanitarian context. Definitely, we believe in that. And that's why we are investing in social service workforce strengthening across the globe everywhere. As you know, as have been said already, actually, so these people are very important who are in the front line. They actually make protection happen on the ground. They turn the system into action. And they reach the children, the community, and the families to provide, or at least to refer to child protection services wherever this is available. But despite this, as we have already said, this is a very under-resourced area. Since the number of social service workforce on the ground, particularly in the front line, is far too low and far too under-resourced. As we have the information in some countries, one social worker maybe in the front line cover around 20 to 50,000 children and families. So this is becoming more and more impossible to deal with for them, particularly when there is humanitarian situation. So that's why we are working on it, and it's important to work together. Because if we don't work together, it will not be that effective in the sense that in the sense that we cannot reach that or many children, we cannot cover that many countries, that many communities with a single agency supporting that. We know that many different organizations are supporting, as Kevin was actually mentioning, names like, Save the Children, UNICEF, World Vision in Uganda case. They're working together to support, but this has to be everywhere. So it's not only in Uganda, it has to be in every country, not only the headquarters, in the country offices of these agencies. We need to mobilize ourselves so that we can work together to reach more children, to reach more families, more communities, and make the efforts that we are doing in the ground level more sustainable. And to make it more sustainable, we need to work very closely with the government. For coordination, I think there are two aspects of coordination. One is the coordination who are working on the ground, like the workforce itself, and how the workforce for child protection or similar areas can work together with other social service workforce on the ground, coordinate horizontally among different actors. This is important, definitely led by the government. And also coordination is needed among ourselves. Ourselves means those who support for a strengthening child protection system, social service workforce on the ground. We need to come together and work together and support the government to coordinate more effectively so that investment is made in the right place at the right time, and the capacity of the social service workforce is further strengthened. So we are working at the global level, as you can see also in this webinar. There are quite a few I have noticed. UNICEF colleagues from different country offices are here. At the headquarter level, we are coordinating very effectively on child protection system strengthening. So when I talk about systems, the social service workforce is also the very important, and I would say that single most important pillar of child protection systems, because as I say, they make the system work. They turns the systems into action. So I would look forward to work together at the global level, definitely, but we will also take measures together how we take our collaboration at the global level to the country level, to the community level, which is already happening, just to strengthen that. So we can invest together in the capacity building or strengthening social service workforce that will strengthen the child protection system and better serve the children and families on the ground. Again, thank you, Save the Children and Global Social Service Workforce Alliance, for adding this very important resource for strengthening community-based social service workforce for child protection. Look forward to work together with you all. Over. And thank you.
Thank you so much, Aminul. I really appreciate the strong collaboration at global and country level as well. We don't have a lot of time left, and we want to make sure that we have time for the closing remarks. There were a few questions, mostly for Kevin. She answered one of them on the financing of training in the chat. Take a look. It's collectively supported by a range of different partners, and I believe private sector is also supporting this initiative in some areas. Kevin, if you can take 1 minute or 2 minutes to answer two more questions. One was, how do we ensure that the parasocial workers do not have a record of abusing children prior to them taking on this role? And the second question is whether there is overlap or collaboration between the village health team members and the parasocial workers at community level. Over to you, Kevin. Thank you.
Thank you, Bagite. Social workers are selected by the communities themselves in an open community engagement and mobilized and supervised by a senior probation and social welfare officer from district level, and thereafter they are voted by the community leaders. So that's how we deal with issues of safeguarding and any violations. And yes, there is both an overlap and collaboration with VHTs. We have had instances where the VHT is also doubling as the parasocial worker, and that is because that's what the community has suggested, and this is their capable person. But we have also had collaboration where in one community we have different people working as VHT and parasocial workers, and these people are working hand in hand. So there's collaboration, and we have engagements within our coordination platforms, which are called child wellbeing committees, where we have a parasocial worker and VHT at the same table speaking about the issues of children. So yes, there's both collaboration and coordination of the two, the parasocial worker and the VHT. Over.
Thank you so much, Kevin, for responding to that. I don't think we have time for additional questions at this point, but we will take a look at any questions that are there and look at how we can respond to that and get that information out to all of you. The session is being recorded, and we will share the recordings and summary of this webinar today. So with that, it is a great pleasure to invite Jane Calder, who is the chair of the Global Social Service Workforce Alliance, to join us with a few closing remarks. Jane started her career also as a social worker and has worked for more than 30 years internationally. Many of those years with Save the Children in a senior advisory position on child protection systems and child protection more broadly. So it's a real pleasure. Jane, over to you.
Thank you so much, Birgit. I shall go through my notes as quickly as I can. I'm very happy to be on this webinar. Thank you. So just thinking about looking through my notes, there's so much agreement between the participants and the panelists in relation to the work that we've been doing. And as we've seen in the poll, I think we can safely say that there's a lot of agreement and that we have managed to meet all the objectives of the webinar. We have 5 objectives. I won't go through them again just for the sake of time, but I think what we've also heard during this session has been the significant need for and welcoming of the guidance related to supporting those working at the community level. It's really, for me, it's been such a pleasure to be involved in this webinar. It's allowed me to reconnect with so many colleagues and friends from my time in Save the Children, and to reconnect with this work for which I think I'm known as having some passion and a real focus on the community level and on parasocial workers and volunteers. But it's been heartening to see indeed how far we've come. As chair now of the Global Social Service Workforce Alliance, I'm just delighted to see the collaboration that's taken place with so many partners and the impressive review of the protection actors at the community level in 9 countries. That really is impressive. The guidance supports a systematic approach, and thank you for going through that so clearly, Yuko and Mana. And it addresses the challenges faced by volunteers and parasocial workers in different contexts, but with surprisingly similar challenges across those 9 countries and contexts. Step-by-step guidance, I think, is and will be particularly useful. Reflecting on what's been said, the community level social service workforce is so important in child protection and other social and in addressing other social issues. If we're not protecting the most vulnerable at the community level, then we're not protecting the most vulnerable. We're not protecting children, because that's where it needs to happen. Protection must be provided locally, as we've been saying and as the guidance says, and be considered a bottom-up approach, so that action to protect happens at the community level, while the laws at the national level and the child protection system at the national level can be used to strengthen that protection. But really, it needs to happen locally. It needs to happen in those communities. And I think we have seen national level child protection mechanisms expected to do all the protecting, and it's very heartening, and I think very appropriate that we're making a change here and we're changing the focus. I think what we've seen, is that stressing and localization, the stress on role clarity has been really important, the stress on training and supervision of volunteers and parasocial workers, and the recognition and integration into the child protection system. So recognition by government into the system. And then I want to say something about the Uganda impressive work that's happened in Uganda, and thank you very much, Kevin, for that. I'm sure, and I hope some of the material that you've developed in Uganda can actually be shared and then contextualized, because it's all about contextualization. We can't do the cookie cutter approach and just take what has been developed elsewhere and replicate it in our own communities. So it is about adapting and contextualizing. I did find in the Uganda experience, and what Kevin was saying, that issue of stipends is just such a critical one and such a complex one, and one that I think we will continue to grapple with. And in addition to that, that whole, the fact that we have thousands more villages and communities than we do kind of national level, actually spreading the protection and actually having it reach all those different communities is a major challenge. So I'd just like to thank the organisers of the webinar, Save the Children and Global Social Service Workforce Alliance in particular, but I know there have been many players and partners involved in all this work. So thank you. And personally, again, I'd like to, I feel very fortunate and very much appreciate finding myself in a position where I can catch up with such positive, good work. And I wish everyone a good rest of your day, and thank you for being on the call. So thank you, Brigitte, and thank you, everyone else.
Thank you so much,
Thank you,
Jane
participants.
Calder. Really appreciate you taking the time to join us with those words.
I am retired.
Sorry, we went 3 minutes over time, but I think we covered a lot in that time. So thank you for your patience there. Wishing everyone a wonderful day. Bye.